gives me immense pleasure to extend to you a warm welcome on behalf of Tecnia Institute of Advanced Studies, who has clubbed all of us for the Health Communication Workshop on Post-COVID Condition. I welcome Dr. Riti Thapar Kapoor, Associate Professor, MIT University, Noida, to please say a few words.
सबसे पहले यहाँ पे आज की ये जो वर्कशॉप है हेल्थ कम्युनिकेशन पे मैं डॉक्टर रिति थापर कपूर फ्रॉम एमईटी यूनिवर्सिटी। हमारा एक प्रोजेक्ट है डीएसटी का जिसमें हमें ये कोरोना के टाइम पे मिला था और इसमें बहुत सारी वर्कशॉप्स दिल्ली और एनसीआर और बहुत यूपी के बहुत सारे डिस्ट्रिक्ट में करनी थी। कई जगह हमने की, आज ये 9th वर्कशॉप है। इसका मेन ऑब्जेक्टिव है कि कोरोना एक तो अभी गया नहीं है, हम फिर से केसेस देख रहे हैं, हम न्यूज़ देखते हैं, यहाँ तो सारे मीडिया स्टूडेंट हैं, उन्हें और ज़्यादा पता होगा। चाइना में भी बहुत सारे केसेस आए और ये हमारा पीछा तो नहीं छोड़ने वाला है, लेकिन हाँ कौन से ऐसे सेफ्टी मेजर्स हैं जिससे हम बच सकते हैं या हम और लोगों को इसके बारे में बता सकते हैं जिससे कि फिर जो हमारा नुकसान पहले हो चुका है, हमने बहुत सारे लोगों को खोया, अपने साथ वाले, अपने फ्रेंड्स, अपने परिवार वालों को, कि फिर से ऐसी चीज़ें रिपीट ना हो। हमें देखना है कि वैक्सीन्स आज अवेलेबल है, लेकिन अभी भी बहुत सारे मिस इन्फॉर्मेशन है लोगों में। लोग ये सोच रहे हैं कि वैक्सीन ठीक नहीं है, इसके कुछ साइड इफ़ेक्ट हो सकते हैं। लोग बूस्टर डोज भी शायद सबने अभी ली नहीं है, बहुत सारे इसके बारे में है, लोगों के मन में डाउट है। उसके बाद और हमें अपने लाइफस्टाइल में, कोविड तो फिर आता जाता रहेगा, लेकिन जो ये स्ट्रेस की कंडीशंस हुई, जितने जहाँ तक अभी मेरी डॉक्टर्स तो यहाँ पर हैं, बहुत सारे बात हुई है, जितने लोग कोरोना से नहीं गए उससे ज़्यादा लोग दहशत में, हार्ट अटैक लोगों को आए, स्ट्रेस में और बहुत सारी बीमारियां उन्हें हो गई, उससे ज़्यादा नुकसान हुआ है। तो किस तरह से हम बचें, अपनी लाइफस्टाइल को कैसे चेंज करें, खाने पीने का क्या ध्यान रखें। हमने अभी देखा, इसमें हमने बहुत सारी पॉजिटिव चीज़ें भी देखी, कुछ नेगेटिव भी देखी, हमने बहुत कुछ सीखा। हमने फिर से अपने जो ट्रेडिशनल वैल्यूज़ थे उनको भी जाना। हमारे घर में जो सामान थे जिसकी हम पहले शायद बहुत केयर नहीं करते थे, जो हल्दी है, मुलेठी है, तुलसी है, जो हमारे घर में हमारे बाबा और दादी सब बताते थे, हम शायद छोड़ करके हम कुछ वेस्टर्न डाइट फॉलो करने लगे थे। लेकिन फिर से हमने इसकी वैल्यू जानी कि कैसे हम बच सकते हैं और कैसे लाइफ, जैसे कि बहुत सारे और चीज़ें हैं, अभी यहाँ डॉक्टर्स बताएंगे, योगा है या और क्या हम ध्यान करके अपना जो कंसंट्रेशन बढ़ा सकते हैं और कुछ अपना लाइफस्टाइल सुधार सकते हैं। तो मैं बहुत ज़्यादा यहाँ टाइम नहीं लूँगी। मैं चाहूँगी यहाँ पे डॉक्टर धर है और डॉक्टर विवेक शर्मा है, ये और ज़्यादा इन सब के बारे में आप लोगों को बताएंगे। और अंत में मैं डॉक्टर निवेदिता का बहुत ज़्यादा शुक्रिया करना चाहती हूँ, जिन्होंने बहुत कम समय में, लास्ट वीक ही हमारी बात हुई और मैम ने सारे अरेंजमेंट कर दिए। सो थैंक्स अ लॉट एंड ऑल द फैकल्टी मेंबर्स, मयंक सर, thank you very much.
I would like to request all the dignitaries to please come forward for lamp lighting before Ma Saraswati. I would like to request Dr. Nivedita, Head Training and Placement, to welcome Dr. Vivek Sharma, Chief Guest, with a bouquet of flowers. Now I would like to invite Dr. Vivek Sharma to put some light on post-COVID conditions. He has more than 10 years of experience as consultant in internal medicine and is currently working in Max Smart Super Speciality Hospital. Sir, please.
It was a very short notice when I was told that I have to talk here on post-COVID complications. I can see a lot of young guys here. So I think you are all students, college-going students. So, but you have seen COVID, right? So how many of you have had COVID? Can you raise hands? Okay, quite a few. So it was survival of the fittest, right? So the people who were fit, they survived, right? But many could not make it. Now, one question, most of my patients, I'm just giving it just a general health talk, nothing specific. One question, most of my patients of post-COVID situation, they who had COVID in the past, ask me one thing, that why some people could not make it and we made it. हमें तो पता भी नहीं चला COVID आया और निकल गया. For us it was just like a normal flu, right? Why does it happen? This is a universal question for each one of the patients. And even for those, even people who never had COVID ask this. So, I will like to throw one, light on it, and that is that everything depends on your innate immunity. Innate immunity means immunity that is given by you by God, given to you by God. Now, the innate immunity is different for each one of us, right? Now, what does it depend on? It depends on your lifestyle. Nothing else except your lifestyle. We all have it, but the innate immunity will work or not when required. When COVID comes, if suppose you face COVID, your immunity is going to work properly or not depends on your lifestyle. Post-COVID complications we are having, post-COVID syndrome. This is what it is called. So what is it? People who had recovered from COVID have been found to have complications 4 weeks post-COVID. Hitherto they were normal after COVID, but now 4 weeks post-COVID they have some complications. Now there are people who have complications after 12 weeks also. Now these people kept on calling them as long haulers or long COVID. Now what are these complications? This is what this talk is all about. So COVID it is a new disease. There is not much of the literature available here in medical science. It will take years of experience after COVID when it will be written black and white in medical books that yes, this is proven complication of COVID. But based on the experience or based on the kind of patients coming to us post-COVID, we can say, yeah, this could be due to COVID. Now, what are these complications? COVID has affected from head to toe. No system has been left. Somebody is affected by COVID in the form of hair involvement. Stress, mental stress leads to something called, now if somebody, it's not just the patient, it's the relatives also. If somebody has lost a near and dear one due to COVID, he goes through something called post-traumatic stress disorder. Now, what is this? This is a mental illness, it's a neuropsychiatric symptom, and hitherto before COVID the patient never had it. Now, why are these patients having these problems? Yeah, this is a stress-induced problem. This is not due to COVID, it could be due to any other stress also in life. So this is a general complication. But there are some specific complications also. The COVID affects. Now, if I take neurology, the neurology system affected by the COVID. Now people come to us with anxiety, increased depressive symptoms, something called schizophrenia. These are some of the symptoms which were, now what COVID did, there are some predisposing factors. Now suppose somebody is having an anxious mind. Before COVID he was having a low level of anxiety. Post-COVID that surfaced, they came onto the surface and the patient became a full-fledged patient of anxiety or mania or manic depressive disorder. This is what COVID did. This was the harm the COVID did. Anybody who was a pre-diabetic. Now somebody is having, how many of you have a family history of diabetes? Your parents or your near and dear ones, the blood relations have diabetes. Delhi is the Delhi, I'm a diabetologist, so I can tell you that Delhi, as per I'm telling you the numbers, Delhi is called in medical science the diabetic capital of whole world. I'm not talking about India. It is a maximum number of patients of diabetes is in Delhi. Now, why is it so? Again, it is due to lifestyle, hell number of things. But these are the figure. Now, you are having some of you are having, you raised hands, are having diabetic patients in your family. Now that makes you prone to become diabetic later on in life, like 5 years down the line, 10 years down the line. Any stressful illness can make you diabetic. Now this is the harm COVID did. COVID came, it affected you, you were, you surpassed it, but you became pre-diabetic, or from pre-diabetic to diabetic. I don't know how many of you had COVID and you have checked your sugar levels or HbA1c, right? So this is again a very important complication. Then again, the side effects of the medicines people had in COVID, especially steroids. You have read the newspaper so many times that high dose steroids were given. Again, the exact dose of steroid to be given was not known, even to the medical people, because it's a new disease. So it was all experimental. People who had been given high dose of steroids had complications of steroids. One of them was actinomycosis or rhinomycosis, because that is a fungal infection. So this was a life-threatening disease again. Now, later on in life, because you had high dose of steroids, you became prone for diabetes. This is again post-COVID complication. But again, where is the answer? The answer lies in lifestyle. Nothing else can help. There is no drug or medicine that can prevent these complications or treat these complications, but you have heard the proverb that prevention is better than cure. So if you want to prevent these complications or don't want to face these complications of COVID 5 years down the line, 10 years down the line, right? Improve your lifestyle. Now what does lifestyle mean? Now you can go to YouTube and there are so many videos on this. Dr. Google is always there with you, right? So, but this is not about Dr. Google. Lifestyle again means improving your, what do I mean by saying this? Improving your lifestyle in a structured and organized way. So there is a way to it. Now one very important thing is medical nutrition therapy. That is the diet you are taking. Everything you are taking inside. I can see so many students, just now even I was coming into the institute, I could see so many students taking, something to eat from cold drinks, bhalla papdi and all that stuff from outside. Now this is okay, once or twice is okay, but let me tell you one thing. Whatever you are taking inside your body is going to affect every cell of your body. Now this you will not come, these are long-term complications, you will not be able to relate it even. Who knows that you are diagnosed to have dyslipidemia or high cholesterol 5 years down the line? At that time you will not even know that why you were, for a long time you were having pizzas and that is causing this, right? So you should be very, consciously taking your food. This is very, very important if you want to rightly correct your lifestyle in an organized way, right? I can talk a lot about medical nutrition therapy, but I don't have time for this. I will just name few important aspects of lifestyle improvement. Another thing is sedentary lifestyle and increasing your screen time. Increasing your screen time, again, online mode of classes and online mode of work schedules, erratic schedules. You all know this. I'm not telling you anything new. But what I want to tell you is that you have to be conscious about it. If you are conscious about it, I have to work on screen for suppose 4 hours, right? If you are conscious about it, you will work for 4 hours or less than that. If you are not conscious, you may go for 6 hours. If you are conscious about what you are eating, you can eat pizza. But next time when you eat pizza, you will remind yourself, yaar, ek hafte pehle hi to khaya tha. This is what it is. So, these are small things, but these are very important things. Then again, what kind of diet you are taking, how much carbs you are taking, how much fat you are taking, this is very important. How much calories you are burning is very important. You know, you have your parents at home. They can't run, they can't jog, they can't go to gym, right? So what can you do for them? So there are so many exercises that can be done even on on your bed, sitting in your room, and you can burn as much as calories as you are burning in the gym. Okay, so you have to just check out those things. I can't go into details because of lack of time. Then you have to mix and match. Mix and match means you must do some yoga, you must do some sitting breathing exercises. At the same time, you must do some aerobics. Now, why I'm saying this is that one single methodology cannot address all systems of the body. When you are just sitting, relaxing, and just doing breathing techniques, you are just improving your neurology system, you are improving addressing your respiratory system, and one or more systems. But if you want to, suppose, improve your blood circulation, if you want to improve your heart health, if you want to improve your digestive system, you have to mix and match. For that, you must do some, you are young, you can do these things like, you can slowly jog, right? Doing jogging is considered as the best exercise. And if you are able to run, you are young. People who are post 40, post 50 can't run. They cannot run. They are not supposed to run because that will injure their knee joints. Before 40, you can do this and it will go a long way. If before 40, you are able to run very fast for 5 seconds and rest of the time, like next 10 minutes, you are just slowly jogging, brisk walking. This can go a long way in improving your health and your lifestyle, your immune system, your mental health, along with your physical health. Now, if you are doing it for 5 years before you reach 40 or 10 years before you reach 40, this will go adding your good health for at least 60, 70 years, till 60, 70 years. You know, so this is again the second aspect. One is the medical nutrition therapy, then the physical exercise mix and match. Then third, very important thing is stress management. You know, how many of you feel that you are under stress? Raise your hands. Okay, so rest of you are not stressed, you are just relaxed, right? You don't have any stress in life, right? So some people have the courage to say this, some people don't. Address your stress. Now, addressing your stress again is an art. Addressing your stress is an art. What is that art? You have to again be conscious about it. If you are able to know, you know, so many, I am in Max Hospital, I am also heading the PHP department, that is the preventive health program. Now, prevention is, I always believe in prevention is better than cure. Now, so many people who are doing their PHP checkups, they come to me and they say, sir, how do I improve my stress? Now, stress management is one thing which I also tell all of them. Now, again, you have to be very conscious about it. There is no one in this world who don't have stress. Right? Be honest. You agree? If you agree, raise your hands. Anybody who does not agree? Everybody has stress. So how do you manage it? Any thoughts? Any thoughts? You can't manage your stress? Any thoughts? Excellent. That's very important. How? But when the stress comes, are you able to do it? You are diverting your mind, but will you get a good sleep when you are in stress? So, a very important thing is managing your stress. And that can happen only when you are conscious about it. Again, you have to be conscious about your health. There is no rocket science. If you are conscious, suppose stress comes. If I am conscious about it, yeah, this is a stress, right? It's going to stay there for a while, okay? It's going to stay there for a while. Nothing is permanent in life. It will go. Then another stress will come. It will go. right? If you are conscious about it, you can deal with it. When she says, I have to divert my mind, right? You can only divert your mind. You can only divert your mind when you know that, yes, I have to divert my mind now. Somebody XYZ is not going to tell you, please divert your mind. You have to tell it inside, right? Just like when you are taking pizza, you have to tell your mind that, Mister, you have taken a pizza 7 days back, please refrain. You will be able to refrain. How? You tell it to yourself, this pizza is going to increase my cholesterol. It's just a moment's taste, but it's going to increase my cholesterol levels, my blood pressure levels, my health. If health is lost, I'll tell you one very important thing from my experience, which you will realize when you are 50s or more than 50s, 60s, 70s. Some people realize when they are in ICU. When health is lost, everything is lost. Means whatever you have earned in life, whether it is relationships, whether it is money, property, X, Y, Z, everything vanishes in front of your eyes. It feels to you that you have lost everything. What next? So this does not happen when somebody is going to die. This happens when even you get a severe pain in abdomen and you are in hospital emergency. For one moment, everything is lost. This is a big fact and you have to realize it. So if you realize that if I'm losing my health, I'm losing everything. If you won't be able to take care of your parents if your health is not good. So taking care of your health is something which is the most. So what does stress do? When you are in stress, what does it do? When you are in stress, we used to read in first year MBBS in physiology that when you are in stress, the brain releases certain hormones which are called stress hormones. They are steroids, right? There are 5 to 10 different types of steroids released from brain. This is damaging your body like anything. When you are in stress, these hormones will be released. Your sugar level will go high, even if you are not a diabetic. Your sugar level will be high. It will dampen your immunity. You are prone for infections. You are prone for XYZ diseases, especially when you are having repeated stress. So now when the next time the stress comes to you, what is the first thing you are going to tell yourself? Yaar, it's going to hamper my health. If my health is hampered, how can I deal with this stress? So first I want to do with this stress is, I am not going to affect myself. Right? This is the first thing. Then deal with it. Even if you are not able to deal with it, you can't do anything. If you can't do anything, leave it to God. But don't stress yourself. This may not happen. This is easier said than done. But when you try it repeatedly, it definitely helps. Right? So, when asked that how to deal with post-COVID complications, what are the complications? Whether it is, so many people come with hair loss. So many people come to me with history of recurrent vomitings, unable to digest. Khana khate hain and you have to pass stools. Khana khate hain and you have to pass stools immediately. This is a very common thing post-COVID. Why? Azithromycin was given, unconditionally. So antibiotics during COVID, damaging your digestive tract. So, then heart problems. What does COVID do? It thickens your blood, makes it prone for clot formation. So many people who had heart attacks, pulmonary embolisms. So again, they were put on blood thinners. Right? Now, during COVID, post-COVID patient, one of my patients came to me. The patient patient's father had a COVID, and he was put on blood thinners, right? What happened? He was able to survive with blood thinners. He did not have further complications. But one fine day he slipped in the bathroom and he fell. He had a head injury. Now, see the indirect complication of COVID. He had a fall, he had a head injury. Because he was on blood thinners, he had a brain hemorrhage. Right? So this is the indirect way COVID has affected people. Otherwise, it would not have been, or he might have not had, brain hemorrhage. So otherwise also, people who are on blood thinners should be very cautious and should prevent falls in the washrooms, right? So I can keep on going on and on. I take very long lectures usually, but let me tell you the bottom line. The bottom line, I think the time is over. Okay, so I think the bottom line is that there is no medicine for post-COVID complications. There is no medicine to prevent further COVID attacks. Right now, we have a strain in the society that is H3N2. That is not COVID. That is a strain or a sister of influenza, right? So it's not very disturbing as of now. We are not getting so many hospitalizations, except for people who have comorbidities. If you want to prevent COVID in your future, because you never know which strain of COVID may come again. If you want to prevent the complications of COVID, if a new strain comes, we will be affected. All of us, you know it, right? How to prevent complications of COVID if a further strain comes? The bottom line is that especially if you are having some, or your parents are having some comorbidities like diabetes, hypertension, heart diseases, or any other like hypothyroidism on thyroid drugs, improve your lifestyle right now. There is no other way. There is no medicine, just lifestyle. Right? I'm very shortly, within 6 months, I'm going to formulate a lifestyle management program, and that will be unique, one of its kind. And I'm going to, structure it in such a way that it will include a holistic approach. Nowadays, the holistic approach is very much in. Even the Medical Council of India is including or inculcating, Ayurveda in MBBS. There are talks going on this. There are some discussions going on this. This might happen. Holistic approach means not just allopathy. In allopathy, how many diseases have a cure? I can list on my fingertips. Not more. There are thousands of diseases. Tuberculosis, for example. You take 6 months medicine, you are cured for life. Diabetes, you are not. Diabetes, you have no cure. If you are diabetic, declared diabetic, you are once a diabetic for life. So you don't have cure. So diseases which don't have cure in allopathy, we can take help from, and we can include naturopathy, Ayurveda, homeopathy, and yoga therapy, and similar therapies to include one program under one umbrella. You get everything, so this kind of program I'm trying to structure out. Thank you so much. All the best for your good health.
A health journalist. She's former deputy editor of The Hindu. Ms. Dhar is now a public health communicator and co-founder of Treasure Development Foundation, a non-governmental organization for strategic communication. At present, RTG is providing consultancy to Center for Advocacy and Research, Delhi-based NGO working on media advocacy on health, women's empowerment, child rights, and transgender. She has been a guest speaker at various central universities and national institutions. I request ma'am to please come and address the audience on health communication and reporting, ma'am.
So today I'll tell you about health reporting. I don't know how many of you will actually be reporting on health, but from my experience, I can tell you one good thing that COVID has done is brought focus on health. 25 years ago, when I came into the profession, health was not a priority for anyone, either the government or certainly not for media. and I was in one of the best news papers. They gave some dedicated space for health, but as far as routine stories were concerned, there was very little space. Then SARS happened, then dengue came, then things like that, diseases like that came. So we got little attention, but ultimately it was COVID that brought the focus globally on health reporting, which was good for health reporters, but unfortunately bad for people. Anyhow, every adversity brings with it opportunities. So COVID also gave us some opportunities, particularly for media. And I'm glad today that health reporting is a part of your syllabus. Even if it is not a part of your syllabus, at least some attention is being paid on health reporting. Because most of the times what we have seen is anything you feel like writing goes into health. Now, health concerns everyone, and we cannot afford to go wrong on health because it is ultimately about your lives. It's a matter of life and death, and you cannot afford to be casual on it. But unfortunately, that was the case until some measures were taken to improve. And I think UNICEF, Government of India, and several organizations did their bit, but ultimately, lot of focus was given on training budding journalists or even practicing journalists on writing health stories, what it meant and what it should be like. So I have a small presentation. I will not go into details, but I just want to give you a sense of what health is all about. I don't know how many of you have studied health in your course. Is it part of your syllabus? Okay, so you're aware of the definition of health. So I don't need to tell you all this. This is just the basic. And then from health comes health communication. Communication, by now you all know what it is. And what is special about health communication? This is WHO definition again. Is the study and practice of communicating promotional health information, such as in public health campaigns, public health education, and between doctor and patient. Now, promotional health information, we are not talking about treatments. We are talking about preventing bad health, right? So you're not telling patients or people to take so-and-so medicine for so-and-so diseases. That is not our job. We are not doctors. Let's leave that for doctors. But what you can certainly tell the people how to prevent diseases or bad health. Like Dr. Sharma just told you, how to prevent diabetes, how to prevent high cholesterol, stress. These are all part of health. So the purpose of disseminating health information is to influence personal health choices by improving health literacy. Now, health literacy, how do you increase health literacy? Through media, through official campaigns, and now social media is, of course, a part of it. It comes with its own disadvantages, but it is an important channel. It is a very, very influential channel, right or wrong. Let's leave that debate for other time. But yes, it is very, very important. So health communication, like any other communication, is verbal. What you say orally, it can be written, what you write. And what it does is it makes people think and decide on their personal health choices. It is important that it should be accessible, information should be accessible, actionable. People should be able to act on it, credible. It should be from a credible source, not any doctor or any Baba or anyone. It's not like that. It has to be credible. Relevant. Suppose Japanese encephalitis is in UP. You can't go and tell Tamil Nadu people to follow JE precautions. It's not of use to them. And then it has to be timely. It has to come when it is needed, not before, not after. Maybe before, yes, but not after that. It will not make sense. It will not be of any use. And understandable. People should be able to connect with it. So as I told you, what did COVID do? It brought focus on health issues. So it was one of those news that was on the front page and carried as the lead for over 1 year and globally. Never ever before has this kind of thing happened as far as health is concerned. Yes, politics, crime can be there, but never for such a long time, and one issue that was global. And it gave space to health, whether in print, in social media, television, equally. And people adopted health-seeking behaviors. By health-seeking behaviors, we mean preventive measures. People took preventive measures. Hand washing was there. Wearing mask was there. We had seen people in Korea and China wearing masks, but in India, no one ever thought they would wear a mask. Even in the worst of times, when COVID had struck, we did see people refusing to wear masks. But generally, ultimately, people did have to wear. And even now, we see people wearing masks. So that means some health-seeking behavior was adopted. Now let's come to writing health stories. Can anyone tell me what do you, let's not look at this. Have you heard of Media Doctor in your course? You just said course is there. Health is there in your course? Okay, no. So Media Doctor is a website that was started in Australia, which gives a broad sense of criteria or protocols to be followed when you write health stories or medical stories. So what are the elements that have to be included in health stories? Health story cannot be imaginative. You cannot use your imagination or creativity in health stories. Politics you can do, but not in health. It has to be factual. And it has to be written in such a way that it influences people's thinking. And if people take action on what you write, by you I mean journalists write, it has to be helpful. So when you write health stories, you have to think before you write. What are you writing and what is the kind of impact it is going to have on people's health? Because when people read your stories, you have to first think that when people read your stories, and if they act on it, how is it going to impact them? If you write, take kerosene or take a blood thinner, one, you're not supposed to do that because you're not a doctor. Suppose you talk to a doctor and he says, in such a situation, people should take paracetamol or should take a blood thinner. Suppose somebody takes a blood thinner and it doesn't suit him or her. Who's responsible? So as a journalist, you have to think. Maybe the doctor has said, but doctor has made a general statement. As a journalist, you have to think your copy is reaching to someone who may not know he has a condition and he's not supposed to take it. He may take that medicine thinking it has appeared in a leading paper and it would be right. And this is how media works. This is how media influences. I'm sure you all know the influence of media. That's the basic in journalism, mass communication. So if you write, take this medicine for this disease, it can have adverse impacts on some. So who's responsible for that? Think before you write all these things, right? So Media Doctor has devised these guidelines. Medical treatment assesses their quality using a standard rating circle. It has a rating tool, and what they say is the story is novelty in treatment, treatment option. Does the story give treatment options to a patient? Does it give disease mongering? Is it creating fear among the people? Does it give evidence? Does it tell you that, okay, if you take this treatment or this medicine, there is evidence to show it is good or it is bad? Does the story give that? And a quantification of benefits. Does it tell you the benefits? harms and cost of treatment. Now, this may sound a little outlandish, and you may not be able to accommodate all these in your copy, but broadly, when you write a copy, what do we think before we type? Suppose you're supposed to write, you have been asked to write a copy on H3N2, or maybe let's come to tuberculosis. Can anyone tell me what will you think before you write a copy on tuberculosis? Suppose your editor tells you, or the news editor tells you, I want a story on tuberculosis because World Tuberculosis Day has just gone. What will you include in it? Can anyone tell me? Please stand up. Who's there? Yeah, please. Doesn't matter even if you're wrong. You're a student. You're here to learn. हाँ, बिल्कुल ठीक. जी, बिल्कुल ठीक. और इसमें एक चीज़ आपको और करनी है, एक डॉक्टर से बात करनी है, क्योंकि आप डॉक्टर नहीं हैं, आप सब कुछ दे सकते हैं, या आपको एविडेंस देनी है. जैसे WHO की वेबसाइट पे आप जाएंगे, उसमें जो कॉजेज दिए हैं वो कोट करेंगे, अपने से नहीं देंगे. आप लिखेंगे WHO ने बोला है ये करने के लिए, ठीक है. WHO मान्यता प्राप्त है ना. और उसमें सिम्टम्स क्या होंगे, कॉजेज क्या है, और सबसे ज़रूरी बात जो है, बैठ जाइए. वेरी गुड, एटलीस्ट यू गेव इट अ थॉट. जब आप ये सब लिखते हैं, ये आप इंफॉर्मेशन दे रहे हैं, ठीक है, लोगों को टीबी के बारे में इंफॉर्मेशन दे रहे हैं. एक इम्पॉर्टेंट चीज़ होती है मैसेजिंग. हेल्थ रिपोर्टिंग में मैसेजिंग का बहुत इम्पोर्टेंस होता है. एक है इंफॉर्मेशन, टीबी में ऐसे होता है. दूसरा है टीबी की ट्रीटमेंट के लिए आप इस हॉस्पिटल जा सकते हैं, मुफ्त मिलता है ट्रीटमेंट गवर्नमेंट संस्थाओं में, सेंटर्स में. मैसेजिंग क्या होती है? मैसेजिंग एक इंफॉर्मेशन ही होती है, लेकिन उसमें प्रिवेंशन होता है. जैसे अभी दिस यंग स्टूडेंट सेड, उससे बचना कैसे चाहिए, उसको हम मैसेजिंग बोल सकते हैं. हाउ टू प्रिवेंट, ठीक है. मास्क पहनिए. पहले तो शर्म आती थी लोगों को, अब तो वो शर्म नहीं है. एनीवन कैन वेयर अ मास्क फॉर योर ओन सेफ्टी. आप मास्क पहन सकते हैं, भीड़ भाड़ वाली जगह पे नहीं जाइए. अगर आपको लग रहा है कोई खांस रहा है, या आपको मालूम है कि आपके घर में किसी को टीबी है, या फ्रेंड्स में किसी को टीबी है, या वर्क प्लेस में किसी को टीबी है, तो इसमें कोई बुराई नहीं है. आप मास्क पहनेंगे, उसको बोलेंगे मास्क पहनने के लिए. इट्स एक्सेप्टेड नाउ. तो ये एक मैसेजिंग है कि इसको प्रिवेंट कैसे किया जाए. प्रोटोकॉल्स कोविड के ही हैं, वो फॉलो कर सकते हैं आप. और ट्रीटमेंट अवेलेबल है. सबसे ज़रूरी कि इसका ट्रीटमेंट है. इट इज़ नॉट कोविड कि जिसका कोई ट्रीटमेंट नहीं था. द डिजीज वॉज न्यू. टीबी इज एज ओल्ड एज ह्यूमैनिटी, और अभी तक उसका पूरा क्योर नहीं आया था. अब क्योंकि फोकस टीबी पे है, इसका ट्रीटमेंट फ्री मिल रहा है, मेडिकेशन फ्री है, और सबसे बड़ी बात ये ठीक हो जाता है. इसको प्रिवेंट भी कर सकते हैं, इसको ठीक भी कर सकते हैं. कोविड में प्रिवेंट कर सकते थे, ठीक नहीं कर सकते हैं, है ना. टीबी में क्या फर्क है, इसको प्रिवेंट भी कर सकते हैं, इसको ठीक भी कर सकते हैं. तो ये जो मैसेज है कि इसको ठीक भी कर सकते हैं, प्रिवेंट भी कर सकते हैं, ये जाना जरूरी है. और ये आपकी रिस्पॉन्सिबिलिटी भी है एज जर्नलिस्ट, लोगों को इन्फॉर्म करना. आप अक्सर देखेंगे रूरल एरियाज में, मैं शहर की बात नहीं करूंगी, आई डोंट नो हाउ मेनी ऑफ यू आर फ्रॉम रूरल बैकग्राउंड, जिनके लिंक्स अभी भी हैं. एक न्यूज़पेपर आता है, पूरी फैमिली उसको बैठ के पढ़ती है, और दुकान पे बाहर बैठ के चारपाई लगा के, कुर्सियां लगा के एक न्यूज़ का एनालिसिस किया जाता है. जैसे सपोज टीबी की ही कोई न्यूज़ छपी है, तो उस पर डिस्कशन होगा. यहाँ पे डिस्कशन नहीं होगा. आप हर बंदा एक न्यूज़ पढ़ेगा और अपने हिसाब से उसको समझेगा. गाँव देहात में ऐसा नहीं होता है. वहाँ एक न्यूज़ आती है, एक कोई उसको पढ़ेगा और उस पर डिस्कशन होगा. उस डिस्कशन में अगर मैसेजिंग आए, हाँ जी इसका ट्रीटमेंट तो है, हमें जाना चाहिए. अच्छा, मेरे घर में किसी को 2 हफ्ते से ज़्यादा खांसी आ रही है, या बलगम के साथ खून आ रहा है, या वज़न कम हो रहा है, तो हो सकता है उसको टीबी होगा, तो मैं कहाँ जाऊँगा. स्टोरी टेल्स यू, पास के स्वास्थ्य केंद्र में जाइए, वहाँ इसका उपचार मुफ्त है. तो ये मैसेजिंग है. यू आर नॉट ओनली इन्फॉर्मिंग द पीपल, यू आर ऑल्सो गिविंग देम चॉइसेस कि कहाँ जाना है. By doing so, you are preventing the disease from spreading. अगर उसको सिर्फ symptoms आ रहे हैं and he goes to a health center very early, उसका डिटेक्शन भी होगा, स्क्रीनिंग भी होगी, उसका ट्रीटमेंट भी जल्दी शुरू होगा. ट्रीटमेंट जल्दी शुरू होगा, वो ठीक भी जल्दी होगा, और जितना जल्दी ठीक होगा डिजीज स्प्रेड भी नहीं होगी. सी वन मैसेज हैज अ फ्लो, हाउ इट कैन इन्फ्लुएंस others, your readers. Here others are your readers. ठीक है. Choice of words, what happens? आपने अक्सर पढ़ा होगा पैनिक इन सो एंड सो कॉलोनी. और ये कोविड के दौर में तो बहुत ज़्यादा हुआ था. इतने लोग कोविड, इतने एक घर में इतने लोगों को कोविड हुआ, आतंक फैल गया मोहल्ले में, कॉलोनी में आतंक फैल गया, दहशत फैल गई, भय का माहौल, भयावह स्थिति. Kindly abstain from using these words. The idea of writing a story is to give hope, to tell them that you have choices to protect yourself, to get yourself treated. Using these words can sensationalize a story, can catch eyeballs, but when it comes to health, the responsibility is much more. यहाँ पे रिपोर्टर्स में हैव अ लेसर रोल, बट जो लोग डेस्क में जाएंगे, एडिटिंग में जाएंगे, आप में से कई लोग जाएंगे, ये उनके लिए ज़्यादा है, क्योंकि जो हेडलाइन होती है वो ज़्यादातर डेस्क से बन के आती है. तो अगर आप में से कुछ लोग डेस्क में जाएंगे और इस तरह की सिचुएशन आए, काइंडली थिंक बिफोर यू गिव अ हेडलाइन. इट मे बी वेरी कैची, बट you know, it's a matter of your health and even that of your family. So I've told you about messaging. हाँ, correctness of messaging. Okay. 1970s में, आप तो शायद पैदा भी नहीं हुए थे तब. आप, if you ask your parents, they would have been around. एक नारा आया था, हम दो हमारे दो. Are you familiar with it? Okay, you have heard about it. It was about keeping your family short, small. दो बच्चे होंगे, you'll have a healthy life, mother will have a healthy life. But what did it do over the period? Can anyone tell me? It resulted in female feticide. Because everyone wanted a boy. And if they had a choice, if the second child was a girl, they killed her. And this is across India. I'm not talking about any particular community, or it was across India. So correctness of message is equally important. The intention before this slogan was very good, but the impact was very bad. Okay? So think before you. Another thing is abortion in India. आप में से कितनों को पता है abortion legal है इंडिया में? पता है? Can anyone get abortion done? No. So when India started talking about abortion, what they did was they put up huge boards outside health centers कि आप abortion करवा सकते हैं. And I remember I was in a rural area in Chhattisgarh. This is about 4 years back. I was talking to a doctor, and this girl came in, very smartly dressed, and she said, "Ma'am, मैं जा रही हूँ." So the doctor said, "कहाँ जा रही हो? अभी तो you have got this thing done, medical termination." She said, "मुझे exam देने जाना है." And then when we questioned her, she was using abortion instead of a contraceptive. She did not use a contraceptive. She was single. She was not married. I mean, we're not raising questions about her freedom of choice, but she has a right on her body. But you cannot use abortion just because you did not use a contraception. This is where things can go wrong. It was only after many such incidents came to light that the government, now if you see the boards, they will tell you the conditions under which abortion can be done. And both these examples are by the government of India. It's not an NGO or anyone. So the governments can also go wrong sometimes. Intention may not be bad, but things can go wrong. And now of course, with COVID, social media was there, and you had all sorts of informations coming from all over. One had a tough time deciding which was right and which was wrong. So here, when it comes to social media, you have to use your discretion. Please see where the message is coming from. Right? I think the next speaker will talk about it. I'll end this thing here. There's a small, I can't read it here. ये भास्कर में एक समाचार छपा है, कोविड पे है, अभी 25 या 26 को ही छपा था. इसमें सब कुछ ठीक था. ये एक आप बॉक्स देखेंगे, छोटा सा हाईलाइटेड है. इसमें क्या दिया है इन्होंने? क्षय रोग की पुष्टि के बाद सावधानी जरूरी है. हेडिंग तो बिल्कुल ठीक है, अगर घर में किसी को है या वर्क प्लेस में किसी को, सावधानी बरतना जरूरी है. लेकिन इन्होंने इसमें क्या लिखा है? पेशेंट को आइसोलेट करिए और उसके बर्तन वगैरह ना यूज करें, उसको अलग रखना है. क्या होगा इससे? डिस्क्रिमिनेशन, स्टिग्मा, जो कोविड में हमने देखा था. पहले they used to say social distancing, then they said physical distancing. Why was it changed? Because patients were socially excluded. Then they had to change the terminology to physical distancing. इसमें भी इन्होंने किसी को कोट नहीं किया, बस वो शायद रिपोर्टर को किसी ने बोला है और उसने लिख दिया है बर्तन इस्तेमाल नहीं करने, उससे दूरी बनानी है. So you're actually stigmatizing the patient. ये चीज लिखने से पहले आपको 2 बार सोचना पड़ेगा कि जो मैं लिख रहा हूं इससे क्या होगा. अनलेस WHO की गाइडलाइंस में है तब ठीक है, आप कोट कर सकते हैं, लेकिन ये WHO की गाइडलाइंस में नहीं है. WHO की गाइडलाइंस क्या कहती हैं? गुड वेंटिलेशन होनी चाहिए, नेचुरल लाइट होनी चाहिए, जिससे टीबी के मरीज, जैसे टीबी के बैक्टीरिया मर जाए. हाइजीन होनी चाहिए, माउथ कवर करिए जब खांसी कर रहे हैं. और आजकल प्रोफाइलेटिक ड्रग्स भी मिलते हैं, टीबी प्रिवेंटिव ट्रीटमेंट दिया जाता है बाकी फैमिली मेंबर्स को. और केवल पल्मोनरी टीबी इन्फेक्शियस होता है. टीबी बाल और नाखून को छोड़ के हर हिस्से में हो सकता है, लेकिन इन्फेक्शियस क्या है? केवल पल्मोनरी टीबी. वो इसमें नहीं लिखा है. सो यू आर एक्चुअली सेंडिंग अ वेरी रॉन्ग मैसेज. आई थिंक माई टाइम इज ओवर. ओके, so let me skip this. I had done a small analysis of 200 health stories in Madhya Pradesh. Free health checkup camps or blood donation camps comprise 28% of the coverage. और उसमें क्या था? छोटे छोटे आइटम्स थे, ऑर्गेनाइजर्स के नाम थे, बस. कोई इंफॉर्मेशन नहीं, कोई मैसेजिंग नहीं, नथिंग. क्रिटिकल न्यूज किसी के मरने की 13%, सिस्टम स्ट्रेंथनिंग 12%. सिस्टम स्ट्रेंथनिंग इज नए हॉस्पिटल्स, ट्रेनिंग्स. न्यूट्रिशन की केवल 5%. और RMNHCA, दैट इज रिप्रोडक्टिव मदर चाइल्ड नियोनेटल, बहुत कम, केवल 3 क्लिप्स मिली मुझे इन 300 में से. सो यू हैव टू अंडरस्टैंड हाउ लो द कवरेज इज इवन नाउ. सो आई विल स्किप क्राइसिस कम्युनिकेशन, आई थिंक. Okay, what can be done? Why? What are the reasons for these low coverage and bad coverage? I would say, because health was not a priority, and there's no formal training of journalists. I'm glad that this is happening. When we joined the profession, there was nothing of this kind. We had to read and learn, and then work on stories. We have UNICEF, WHO organized some workshops, but these are issue specific. So what can we do now? We need to sensitize media by organizing courses on health. Supreme Court has made it mandatory to have a law degree for reporters who cover Supreme Court. And then there is a defense correspondence course. So I think we should also have courses for health journalists. So this is about my work and these are some of the stories we share with media. Thank you.